Thank you for 20 years of Get With the Guidelines. We've got a lot to celebrate, and we're so happy you're here. Here are a few of the things we've accomplished together. Together, we've tracked more than 10 million patients. Data has been used in more than 600 scientific publications. Since 2016 alone, we've given out almost 32,000 awards to participating hospitals. None of this would be possible without you. If you're one of the nearly 2,500 plus hospitals across the United States and Puerto Rico to implement Get With the Guidelines, thank you for your outstanding performance treating patients with heart disease and stroke with the highest quality care. Get With the Guidelines helps healthcare professionals improve patient outcomes by applying the most up-to-date, evidence-based treatment guidelines. Whether those guidelines are for stroke, heart failure, resuscitation, AFib, or coronary artery disease, hospitals that encourage their consistent use help patients do better. That's quality improvement, and it's what we're all about. Thank you, and here's to the next 20 years together.
Good afternoon, everyone. Good afternoon. Thank you for joining us and welcome. I'm Stephen Warwick. I currently chair the Stroke Committee of the AHA Southwest Region.
And I'm David Wheeler. I'm a neurologist in Casper, Wyoming, director of the stroke program at Banner Health Wyoming Medical Center here, and currently serving as the president of the American Heart Association Southwest Region Board of Directors. I want to thank all of you for taking time out of your day today to join us as we celebrate the amazing work that you do every day here in the Southwest region. Normally we'd be together in a ballroom eating chicken for this event, but now we're all getting used to doing things differently.
So today you may be celebrating this award during your lunch break before we get back to the business of saving lives. We know that some of your colleagues were not able to join us today, so we are recording this program and we will share the link so anyone who cannot attend can view it later. We're very pleased to be joined today by several special guests and extraordinary partners in this relentless movement. Stroke survivor Flannery O'Neill and AHA's Executive Vice President in the Southwest region, Tanya Edwards. We also have special messages from our CEO, Nancy Brown, and two national leaders in stroke care, Dr. Lee Schwamm and Dr. Stephen Messe.
On behalf of all of our volunteers and staff at the AHA, we want to thank each and every one of you for the work that you do. Your relentless commitment to quality care, especially during this year of extraordinary challenges, is appreciated and celebrated. We usually have the opportunity to present you with a certificate and shake each of your hands on stage. Since we're together virtually this year instead, we'll be sharing your photos on the screen beside us throughout the duration of the event today. So we invite you to watch for your hospital, and then you can use the chat box to share your shout outs and to celebrate with your colleagues. So let's get our program started today with a special message from AHA's CEO, Nancy Brown.
Hi, I'm Nancy Brown, CEO of the American Heart Association. Thank you so much for joining us today and for powering our mission to be a relentless force for a world of longer, healthier lives. Science and research are the bedrock of the American Heart Association, and a key pillar of our work in bringing science to life is our Get With the Guidelines Quality Improvement Program. We launched the program in the year 2000 to assure that patients with coronary artery disease received high-quality, evidence-based care during their hospital stay. Over the past 2 decades, Get With the Guidelines has expanded to include heart failure, stroke, atrial fibrillation, and most recently, the COVID-19 cardiovascular disease registry. Stroke is the largest of our Get With the Guidelines programs, with more than 80% of every stroke that happens in this country captured in our registry. In just over 2 decades, you, our valued partners in hospitals across the country, have collected data from more than 10 million patients profoundly deepening scientific understanding of cardiovascular disease. This work is more important than ever as the world confronts COVID-19 because severe outcomes are most common in people with a history of risk factors for heart disease or stroke. Hardest hit are Black, Hispanic, and Indigenous individuals living in under-resourced communities. As a champion of health equity, the American Heart Association is leveraging its voice, our platform, and our resources to identify and remove barriers to healthy living. Our Don't Die of Doubt campaign informs the public that hospitals are still the safest place to be in a medical emergency, as we urge people to call 911 at the first sign of a stroke or a heart attack. As a founding supporter of the Ad Council campaign to encourage COVID-19 vaccination, we are boosting public confidence and helping to keep people safe. We are also encouraging everyone to get their flu vaccination and schedule routine and preventative care. In 12 months since launching a 3-year hemorrhagic stroke initiative with Alexion, we have identified best practices and additional insights that we look forward to sharing across the country. None of this would be possible without your heroic efforts on the front line of stroke care. During an extraordinarily challenging year, you have displayed uncommon courage, collaboration, and clinical excellence. On behalf of all of us at the American Heart Association, thank you for your dedication to ensuring all people have the opportunity to live a longer, healthier life.
Thanks to Nancy for sharing the incredible impact that your work and the AHA's quality programs have had across the country over the past 20 years. And now it's my pleasure to introduce the Southwest Region's Executive Vice President, Tanya Edwards, to share a few thoughts about how important our efforts are right here in the Southwest. Tanya?
Thank you, Dr. Warwick, for the warm introduction and your continued leadership in the Southwest. I am honored to be in the presence of this distinguished group of health professionals and to celebrate the work that you all do day in and day out in our communities. Your participation in the AHA's quality programs and commitment to quality stroke care is saving lives and improving stroke patient outcomes. As Nancy mentioned, over the last 2 decades, your dedication to our quality programs has had a profound impact. Over 80% of strokes that occur in our country are captured in our registry. And that is providing critical data on more than 10 million patients. And that data is propelling science forward and improving lives of so many individuals. Within the 6 states that make up our Southwest region, we are thrilled to celebrate the nearly 200 Get With the Guidelines stroke hospitals. These hospitals have achieved more than 615 stroke awards from 2019 to 2020. Thank you for your commitment to guideline-directed care for every eligible stroke patient. Over the past year, the rapid surge of COVID-19 has created new challenges for treating stroke patients. And you all have faced these challenges head on and worked together to develop and test new protocols and treatments to improve the overall stroke care for your patients. As we continue to face challenges in front of us, I am encouraged by all the work we have done this far and will continue to do for the communities we serve. The AHA will continue to work with all of you to ensure that we are leveraging our platforms and voices to share the messages that hospitals are the safest place to go in an emergency, and we will continue to promote COVID-19 vaccinations. I remain hopeful that next year we will gather in person in New Orleans to celebrate our annual recognition dinner, On behalf of the AHA, thank you for your resounding commitment to the communities you serve and the patients you treat. And it's now my privilege to introduce you to our next speaker, Flannery O'Neill. Flannery, like all of you, is both professionally and personally committed to the fight against stroke. Her story truly embodies today's theme of being a relentless force. Flannery, thank you so much for being with us today and sharing your personal story.
Good afternoon, and thank you so much for the kind introduction. I'm privileged to be here virtually with you all. Like Tanya said, my name is Flannery O'Neill, and I'm a TIA and stroke survivor. Today is an especially exciting day as we recognize and honor the incredible work that you and your teams do every day to care for stroke patients, and I'm so honored to be a part of it. This celebration is more important than ever after what we have experienced in the COVID-19 pandemic, and I'm so thankful for each one of you for providing the high quality care despite this uniquely challenging year. And as some of you may know, I was recently a member of this incredible quality improvement team at the American Heart Association, working in Colorado and New Mexico. So I want to do a quick shout out to all my colleagues there for just the great care that you continue to provide. So many folks view stroke as an older adult's disease. However, about 10 to 15% of strokes happen in people younger than 45. And 4 years ago, at the age of 34, I experienced an ischemic stroke due to factor V Leiden. At the time of onset, my stroke left me completely unable to speak with a facial palsy and a very limp right hand. Looking at me now, you might assume that I've returned to normal, and in many ways I have. However, I struggle with invisible disabilities to this day, and I probably always will. I have aphasia, acalculia, diminished right side sensation, and perhaps most significantly, the lasting emotional trauma from this experience. I do want to share a bit of my story with you in hopes that I can give you the encouragement to continue this life-saving work that you do every day. My stroke story starts in mid-January 2017. I was sitting in a meeting and it was my turn to introduce myself when all of a sudden my right forearm started tingling and feeling numb. I thought it was odd, but maybe I was nervous for some reason. It was an unsettling feeling, and when it didn't feel better the next day, I even joked at work that I was having a stroke. The foreshadowing. But for the time being, I had just brushed it off as carpal tunnel. A week later, I experienced a TIA where I was unable to speak coherently. My hand went completely limp, and I experienced severe confusion. But it all resolved in about 10 minutes, so I was scared, but I didn't go get it checked out. Throughout the next week, I had stretches of time where I just did not feel right. I knew something was wrong, but I wasn't sure that it was enough to warrant a doctor's appointment. And I had an appointment scheduled for the next week, so I thought it could wait. The following Monday, I spent an extended amount of time with my boss, and during a conversation with her, I developed deafening ringing in my ears and was not able to speak. My hand went completely limp again, and I could feel my cheek drooping. I can still see the terrified look on my boss's face. She asked if she should call 911, and I nodded yes, because that was the only thing I could do. I don't remember being scared at that time, just feeling really calm and wanting to go home and crawl into bed where it felt safe. I tried to tell my boss that my husband was gone too, because my dog was home alone, but was not able to get those words out. Fortunately, the paramedics arrived very quickly, and I was rushed to the nearest hospital, which I now know was not a stroke certified center. It is, I had a CT, and that determined that I was having a stroke, but it was thought to be a mild one. So I had an MRI, and soon after that was complete, my doctor came running in and told me that my stroke was much worse than they thought, and I needed IV alteplase, and then I needed to take an air ambulance to Denver for follow-up care, which is a 7-hour drive from where I was living. That's the point where this became really real, and I was very overwhelmed and scared, and just feeling very uncomfortable and unsure of what lay ahead. But about an hour after the infusion was over, I started to be able to speak a little bit and could finally answer when asked what my name was. Numbers, however, were another story. I could not understand numbers at all. I was in the ICU in Denver for 2 days, and thankfully I was able to be discharged home, but I had virtually no care plan in place when I headed home to my small town. It took my families and my coworkers advocating on my behalf to get the follow-up appointments that I needed to start my recovery. Thanks to serving on a board with the chief medical officer of our local community hospital, I was able to get in to see the neurologist and the cardiologist. But I'm definitely one of the lucky ones. Many other people in my rural area and rural areas across the country have limited access to specialty care, and they've not been as fortunate. I was on full-time medical leave for about a month and part-time leave for another month. But through weeks of speech therapy along with rest, I was able to regain my speech and my ability to do math. However, I still struggle with aphasia and acalculia on a daily basis. And the sensation on the right side of my body has not returned to normal. So that makes it hard for me to differentiate between hot and cold temperatures, type on a computer or a cell phone keyboard, ride my bike, run, and do many other things that I could do easily pre-stroke. And the ongoing symptoms that you sometimes get, or the sensations that you might get related to stroke can cause lots of anxiety, especially with the uncertainty of COVID. In the time since my stroke, I've started 2 support groups. And in fact, I have a young survivor group that I host with 2 Colorado hospitals, and we meet monthly. And so tomorrow night, we're meeting on Zoom. Apart from speech therapy, this has been the most impactful part of my recovery. I cannot underscore enough how vital it is to support a patient's emotional health recovery. We really have to be willing to dig deeper with people and understand and support the healing from this trauma. I'm now the executive director of Stroke Onward, an organization focused solely on the emotional recovery and rebuilding of one's identity after stroke. We're a young, growing organization, and we're really grateful for the relationship that we have with the American Stroke Association, who features our co-founders in a bi-monthly column in the Stroke Connection e-newsletter. So as I wrap up, I want to highlight the life cycle of a stroke. Primary prevention is crucial. Let's start with keeping strokes from happening in the first place. But next, knowing the signs and symptoms and taking immediate emergency action is so important. Third, the work and providing the appropriate acute care for patients. So using Get With the Guidelines, it's really a powerful tool to make sure that the most up-to-date guidelines-based care is being provided to all patients, regardless of location. And fourth, the recovery phase. It's really crucial that we are making sure our patients are screened and having access to rehabilitation so they can be as successful as possible in recovery. I've spoken a lot today about my stroke, but I'm certainly not alone in this experience. Every 40 seconds, another stroke occurs. And the number of neurons that are lost in an MCA stroke like mine has been quantified to be about 1.9 million per minute, or 114 million neurons for every hour, which translates to 3.6 years in accelerated aging. With rapid response to this emergency, you can dramatically impact how a stroke will impact your patient's life. I'm so incredibly grateful for all of you here today who are using Get With the Guidelines Stroke. Working to provide guidelines-based care to your patients while they're in the hospital is critical and sets them up for the success as they're being discharged to begin their healing. Thank you so much.
Flannery, thank you so much for sharing this powerful story. It's indeed motivating and cuts right to the heart of the work that we're all doing here in the Southwest region. And we're so glad that you were here today to celebrate with us in person. You inspire us to remain relentless together. And now, it's my pleasure to bring to you a special message from our AHA Chair of the Stroke Systems of Care Advisory Group, Dr. Lee Schwamm, and the incoming Chair, Dr. Stephen Messe.
Hello, and welcome to the Get With the Guidelines Stroke Virtual Quality Achievement Awards. I'm Dr. Schwamm, and I'm here tonight with my colleague and friend, Dr. Stephen Messe. Hi, Steve.
Lee, it's virtually good to see you, as always.
Yes, and Steve, it's great to be passing the torch, or the crown, shall we say, as chair of the Stroke Systems Advisory Committee. Congratulations, and really looking forward to working with you in this new role.
Well, thank you, Lee, and I do want to say that you really were instrumental in building Get With the Guidelines to the important role that it plays today. And so, thank you for everything you've done, and you will always remain the emeritus king and ex officio forevermore.
Excellent. Relentless together, I would say. That's you and I will be relentless together in this task. But tell us what that means to the Heart Association.
Well, so relentless has always been, an important theme for the American Heart Association. And this year in particular, obviously, we had to pull together with all the challenges that we faced. And there's no question that we did that. And this is thanks to all of you and the hard work that you do. But it's clearly being relentless together was the key to getting through this.
Yes, and nobody demonstrated that more, I think, than our frontline staff and nurses in particular. And just want to take this moment to really thank all of you out there who work in the nursing profession, all of you who work to take care of stroke patients, but especially take this opportunity to recognize this as the Year of the Nurse, and we're all extraordinarily grateful to you for that. We've had some amazing accomplishments this year. The public reporting of Get With The Guidelines data is the next evolution in our goal to really becoming the source of truth when it comes to quality stroke care. Have 152 hospitals are now participating. This data gets used by U.S. News in its hospital ranking system and for some hospitals with health plans. So spring enrollment coming up beginning in May. If you're not in already, sign up. We're in. Steve, are you guys in?
I think we are definitely in. Yeah, it's very
Excellent.
useful. So that's going to continue to grow. And speaking of growth here, of course, we're seeing continued enrollment in patients being logged into the database. So now over 7 million this year is where the threshold we passed. And by 2024, we're going to get to 10 million, which is absolutely incredible.
That could be more number of cases than I have unread emails in my inbox, Steve. Speaking of unbelievable growth, here's the just distribution of publications from this program, over 150, searchable database if you want to look and see on a particular topic or a particular module. But it's been a remarkable journey, and we've made such an impact on the care of stroke in the United States and had quite a showing at this year's International Stroke Conference.
For sure. And some of those have already been published. They were done in time with the stroke conference and are very relevant to all the things we've been dealing with this year.
Yes, and Dr. Srivastava with Dr. Fonero published this very important analysis in Get With The Guidelines using the new elements we added in Get With The Guidelines Stroke for COVID specifically, separate from the COVID registry, which was also launched this year, showing that patients with COVID who came in with a stroke had more severe strokes, more large vessel occlusions, longer times, but not statistically significant for some elements of care, but certainly for door to CT, door to needle, door to thrombectomy. But good news, rates of thrombolysis and thrombectomy were unchanged between the groups. So we did the job, it just took longer. Unfortunately, that also meant decreased odds of independence at discharge, higher odds of mortality, whether that's the combination of the delay plus the underlying illness or just the illness itself, we don't know, but it certainly adds fuel to the fire that COVID has an association with stroke severity that impacts patient outcomes. And, when you think about reasons why TPA wasn't given, not surprisingly, the need to put on additional protective equipment had a big impact on the patients with COVID-19, while the traditional reasons for difficulty treating or delays in treatment, hypertension requiring aggressive control with IV medication, much more common in the patients without COVID. And Steve, this is a really interesting study of disparities by race and ethnicity in the use of endovascular therapy among patients who arrived with an NIH stroke scale score greater than 6 within 6 hours, so eligible by time and severity, showing that there is still a persistent but narrowing gap between non-Hispanic whites and Black patients. Fortunately, short-term outcomes are as good or better, and modified Rankin at discharge was the same. Unfortunately, 90-day outcomes were worse in Black and Asian patients. We don't know why, but it's an important area of research, particularly as we think about social determinants of health.
Absolutely. Good news and bad news, but plenty of work to be done.
Yeah, and how about this for good news?
I like it. Increasing use of TPA within 4.5 hours, 80% now. That's remarkable. That's really wonderful.
And despite COVID, further increases in the use of TPA within 30 minutes, door to needle time within 30 minutes. They said it couldn't be done, and now we're doing it in more than 25% of the patients. It's really remarkable.
Yeah, hopefully that's going to continue to grow. And look at the EVT outcomes, recanalization.
I mean, we're now reaching the rates that cardiology has had the joy of living with for decades. And I think when you have 90% recanalization, now it's not about the device anymore. It's about selecting the right patients and providing the therapy in a timely manner. 24,000 patients got a TICI 2B or 3 score this year. That's really remarkable. And lastly, Steve, we need to do a better job of getting the right patient to the right place in the right amount of time. And nowhere is that more important than the pre-hospital arena. And this year we have a major consensus statement coming out of many of the professional societies in the relevant space here, with suburban, urban, and rural modifications to that prior Mission Lifeline stroke algorithm that came out more than a year ago. And I think this consensus approach to modifications based on availability of different levels of hospital capability is going to make a big difference.
There's no question this is an important statement. It's going to clarify some guidance for many, many, many places. And it's great that we were able to accomplish that.
So, Steve, I can't wait to see you next year in the Big Easy.
I love New Orleans. I couldn't think of a better place to celebrate getting back together again, and looking forward to that. And I want to thank all of you for everything that you do, and looking forward to a better year ahead.
On behalf of all of the patients that we care for, all 800,000 of those patients, I want to say thank you to all of you for the incredible work that you do all year long. And we look forward to seeing you soon.
Be well.
Our thanks to Dr. Schwamm and Dr. Messe for sharing this exciting perspective on the overall success of Get With the Guideline Stroke, and also sharing highlights from this year's International Stroke Conference. We all have a lot to be proud of, and thanks especially to you who collect this data.
And again, on behalf of the American Heart Association, thank you for your resounding commitment to the communities and the patients that you serve and treat. Congratulations to each and every one of you for being recognized and delivering award-winning quality stroke care. And with that, we'll bring the program to a close and give you back a few minutes of your precious day. Thank you so much.